All done, buddy.
We have two groups of experts in schools and children. We have healthcare providers and we have teachers. We use the same vocabulary, but we have different dictionaries. So we need to bridge this gap so that we are communicating effectively. Teachers need help focusing children in the classroom, especially when they have health issues that are interfering with their ability to learn.
Perfect. Inside. We're all done.
My name is Connie Ballone. I'm the CEO of the Health and Education Alliance of Louisiana, also known as HEAL. HEAL is a nonprofit in New Orleans with a mission to eliminate health and educational disparities for at-risk students in Louisiana. We do that by partnering with schools across the state to implement health programming, teaching schools how to keep kids healthy so that they can educate them better. We also work with the schools to draw down federal Medicaid dollars to make the positions that we put into schools sustainable over time.
Students in New Orleans face a lot of barriers, and I think that they have experienced a lot of trauma. And so finding ways to provide healthcare in schools, especially behavioral health supports, is going to be critical for those students to be successful. The thing we see when schools implement a Medicaid program is that they have a continuous source of funding for healthcare services, so those positions aren't at risk. We've just had a terrible situation in New Orleans where they're finding out that their budgets have been cut by almost 30% because of an accounting error. And very often in schools, healthcare positions are the positions that get cut first. And so by focusing on a stream of income that isn't tied to those education dollars, these schools can maintain those healthcare services.
Schools don't know about this money and they are not experts at accessing it, but we are. And so we work with schools to eliminate the barriers for them to draw down this funding so that the school nurse and the school psychology position can be permanent year over year and is not subject to budget cuts.
The New Orleans East Opportunity Center is a partnership between the Youth Empowerment Project and Educators for Quality Alternatives. It's in New Orleans East, and we have multiple programs and wraparound services here. Think of it as a non-traditional educational environment where students can get things that they wouldn't normally get in a traditional school setting.
And a lot of young people come in believing that they are not smart. Some of them believe that they're bad because they have failed in so many other settings. So the most important thing we can do is to rebuild their sense of themselves. So by having mental health services built into the school, in a place that students are already happy to be, they trust adults, it's much easier to get them to open up, to start going into therapy, to start working through their issues and concerns, because it's not a separate thing, it's part of the everyday world that they're living in.
Providing services in schools becomes a really effective tool for reaching students in poverty because they don't have access to care in many other ways. And so providing services in schools allows them to see a nurse to get their vision checked. It allows them to see a nurse to help them manage their medications or their diabetes and their sugar levels. It also helps them be able to see a mental health counselor so we can deal with if there's trauma in their family, in their own personal life, and find a way for them to be more successful in schools with those resources there.
HEAL has worked with schools and successfully drawn down over $477 million. That's an incredible number, and that's just Louisiana. This program is limited to 1% of the federal budget, and the more we can access these funds, the more school nurses and mental health care providers and therapists we will have in schools. Our goal is to have a nurse and a therapist in every single school building in Louisiana.
What I really appreciate about Connie and Deb from our very first conversations is that they took the time to understand our context, how our schools are, who our kids are, what we're trying to do with our young people. Sometimes when you're working with a consultant or a partner, it's easy to hear no, and you can't do that, or that's not what we do, or that's not what the rules are. And instead, from HEAL, we hear, how can we make that work for your kids? And that's really what has made us appreciate the partnership with them.